This is epidemiology and the person. We've already went through time and place as epidemiological variables, but there's also the person we have to consider. Things we consider as far as variables that a person go could be age, gender, race, socioeconomic status, even their careers and their hobbies could come into play in the risk factors they take. Person's age. We oftentimes want to consider groups narrow enough to detect an age-related pattern, typically in 5 to 10 year intervals, or a cutoff that has for secular statistics. So a lot of patterns can change with age. If we look at the prevalence of, say, myopia by age, there actually isn't very much myopia under the age of about 5-6 years old at all. And we start to develop myopia actually at the ages of 8, 9-ish is when it starts to really ramp up. And so our incidence is increasing, so that means the prevalence is increasing over time. And so by the time of the age of 20, our current prevalence of myopia in the United States is about 50-55%. And that's how age can change with the prevalence or incidence of a disease. And here's another example just showing that how within age groups we can look for different prevalence and incidence of myopia or any disease we like to look at. Another thing that we think of with age is things like cataracts. There's age-related diseases, so they increase over time. As we can see here from this incidence they plot out here, we've replotted as bar graphs so you can see them. The incidence of cataracts, as you'd expect, increases with age. And so young people have a very low incidence of age-related cataracts, actually of any cataracts at all, but age-related cataracts, because of the nature of the name, only happens with age. And so that's why we consider age as an important factor when thinking about the incidence and prevalence of various diseases, especially age-related ones. But we can also look at other variables. Let's look at sex and gender. This is looking again at the myopia progression over 3 years between boys and girls, males and females. What we can see is there's actually a statistical difference between the progression of females compared to males. Women tend to progress slightly faster than men do. However, it's probably not considered what's called clinically significant. If we look at the difference between the two groups, there might be a statistical difference there, but the difference clinically is under a quarter diopter difference between the two groups. So while there could be a gender difference here, it isn't considered clinically significant, meaning that it really doesn't really matter in the general population, even if it actually is a real statistical difference. We can also look at other things like race, ethnicity, religion, other common biological or social characteristics. Here's a similar studies looking at myopia progression. We see that same thing we talked about over here, which is the age-related change. As the people age, their rates of progression increase. And same thing with gender. Females, again, progress a little faster than men. Well, over here we have then different differences in race. Now again, though, if we look at these, there might be a different statistical difference between these groups, depending on which group we look at. Clinically, there's no clinically significant result here that matters. Everybody progresses at about the same rate, give or take a quarter diopter. So those are things we have to consider when we're looking at persons. Well, we also have to consider their occupation. Perhaps their occupation puts them at a higher risk for certain diseases and disorders. And that's possibly going on right now when we're looking at COVID-19 in healthcare workers. Right? Their healthcare workers are now exposed to this virus at a higher frequency than most other populations, just because they're out there working. There have been some cases of some ophthalmologists and eye care people dying. Well, why would that might be for as far as your career choice goes? Well, here we have a look at a typical person working in a slit lamp, and they're about a foot away or so from their patients. Well, it's actually a pretty short vector to transfer a virus or bacteria, if it's under a foot, from your patient to the doctor. Like we said, that's about a foot. So this is how we can then start to use and impact actual public health methods to try and control these problems. And how we're doing that, as an example, we could put in shields, between the patient and the doctor. That way they get less transmission of the virus. And also everybody could wear masks to help reduce the transmission of viruses. In short, patterns of occurrences of diseases, descriptive epidemiology data enables healthcare providers and administrators to allocate resources efficiently, watch for new patterns of diseases, and surveillance is a cornerstone of epidemiology and public health. Thank you.